Welcome to our training on the Care Transition Call component of Crimson Care Manager. This document and this training has been developed to help you navigate through the Care Transition Call process. The Care Transition Call, or CTC, will take place on the discharge calls being made by MaineGeneral, inpatient, and ED nursing staff. This call form will be in the process that primary care will use to complete both inpatient and ED discharge calls. For those of you using TouchWorks, the information will need to be pasted into a care management note instead of using the text templates on your discharge management. This will satisfy the needs for both inpatient data and primary care or specialty information for the safe transition of care. Why have we started to use this form? This form will help us improve the coordination of care and the transition of care for our patients. Utilizing the improved coordination and communication should reduce our readmission rates and our emergency room utilization. This will allow us to update medication lists prior to the office visits, decrease duplication of the calls that we are currently doing, allow us to collect data on where we are doing well or where we may need to improve, and help us provide unified educational resources for stroke, COPD, and congestive heart failure across our system. You may ask what kind of questions are on this form. At the end of this package, you will see all of the questions for your reference. In general, the questions are related to making sure the patient knows how to care for themselves post-discharge, on their pain assessment and how they're doing, a review of their medications and were they able to fill their prescriptions. There are specific questions related to diagnosis of stroke, heart failure, COPD, and surgery. It will prompt you to update a care plan. It will review the patient's follow-up appointments that were on their discharge summary, and it allows us to give recognition and give the patient opportunities to tell us good and improvement areas. In Crimson Care Management, you will find specific references for COPD, CHF, and stroke. For heart failure, we're using the Maine Health Are You in the Right Zone pamphlet. We're using the Ask About COPD. We're using the COPD Action Plan, the Stroke Risk Scorecard, and Learning About Stroke. The following graph helps explain who makes the discharge or transition of care calls. Practices are all divided into different classifications. As you can see on the left side of the graph, there are 5 levels of PCP practices. The first level, PCP1, are the primary care practices that have care managers in their office. If you go across the columns, you'll see that primary care will be making all the phone calls, both for the inpatient transitions of care, the ED high utilizers, and inpatient high utilizers, and then transition of care for emergency room. This is also how you prioritize the workflow. So inpatient transitions of care would be your top priority on your discharge calls. Your second priority would be the inpatient and ED high utilizers, and your third priority would be transitions from the emergency room. The next row down, the PCP2, those primary care practices 2, have care management done by a quarterback in the office. They also are doing all 3 levels of the calls. Where it changes is in the PCP3, the primary care practices that have no care management staff in their offices. Here, if the patient is a transition from inpatient, the inpatient care management staff will be making the calls. If the patient is a high utilizer, either inpatient or emergency department, the CCT will be making the calls. And if it is an emergency room transition of care, the emergency room will be making the calls. The primary care practices for the PCP4s are those practices that are not part of the KRHA. For there, the inpatient care managers will also be making the discharge calls for inpatient discharges. High utilizers will be done depending on whether they're coming from the inpatient unit or the emergency room. And then transitions from the emergency room are done by the emergency room care manager. And the fifth level have no PCP. So those are patients without a PCP. The inpatient staff will be making those calls for the inpatient transitions of care. Inpatient staff will be making those calls for inpatient high utilizers. And currently we have not defined a workflow for those being discharged from the emergency room. Martha Hunt will also consult on calls from the inpatient transitions for those with knee and hip replacements. She will have access to see the information that you have placed, and you can communicate with her on patients. With the calls, you'll be getting alerts in your email that the patient was a discharge or a transition of care. Our goal is to make those within 24 to 48 hours, and for regulations from CMS, they need to be made within 2 business days.
Please be cautious of the language that we use on the call. As many of you know, we cannot pre-survey our patients for their medical center experience due to CAPS regulations. Please do not lead the patient to always, usually, sometimes, never, yes definitely, nor numerical responses or ratings, except if you're addressing the current pain scale, as these are answers that are on the survey. For example, we may not ask, was your pain always controlled when you were in the hospital or emergency department? Please take care to follow the key words that are found on the care transition call template that you'll be using.
If you have questions concerning the form or how it's used, the bullet names are your resources. You have Evelyn Reinhardt, Judy McLaughlin, Heidi Sherburne, Jody Beck, myself, Michelle Bishop, or Dan Spofford. Please feel free to reach out to any of us with your feedbacks and comments as we update the forms. So now we'll go into the actual workflow. So if you have the printed form in front of you, we are on page 3, screenshot 1. This is what you would see when you logged into your care transition document. This is your home screen, and you can see that you would have the alerts and your tasks related to both the ED visits and the inpatient transitions. You may select your patient from either one of those spots. Once you have selected your patient, you would see screenshot 2. You're looking for the transition of care on the left-hand side of your screen. It will be a blue hyperlink, and if you're looking at the form, it's highlighted by a red arrow. You're going to click on Transition of Care, ED. Here, you'll see what the task will bring up. This task includes the need to complete the care transition call, which is accessed on the patient tab. You will want to review the entire task. Once you have reviewed the task, you may complete it without opening a care note. You will be documenting the care that you provide in the discharge call form. I'm now going to page 4, screenshot number 4. Here we are on the patient's care plan overview page. If you look at the top from the patient's page, you will want to select Forms and Assessments from the drop-down menu. Again, this is highlighted with an arrow. Once you have clicked on Forms and Assessments, you will see screenshot number 5. You will want to click on the plus sign that's identified by the arrow. This is similar to when you open a care note. From here, you're going to see screenshot number 6. You'll be selecting a program. You should see a transition of care program. If you do not, you can pick any other program. Once you have selected a program, you will see screenshot number 7 on the top of page 5, and you're going to want to select Care Transition Call. Currently, that's the only form that's in there, and you will click on Start. Once you click on Start, you will see screenshot number 8. The questionnaire will be showing in your screen. The questionnaire has 2 options. The first one is if you're leaving a message. It has a script if you are unable to reach the patient. You'll want to leave a message for the patient and make a second attempt later. The second option is if you reach the patient. This will start the call, and here's the script on how you would introduce the form. You can use the gray bar on the right side of your screen to move down the questionnaire. As you go down the questionnaire, we are now on screenshot 9 on the top of page 6 if you have the training document. You will need to answer all the applicable questions. To see all the questions, you will continue down using the gray bar. Also, at the end of this training, or if you have the hard copy, the last pages 8 through 11 of this document contain all the questions if you would like to see them written out to review before you make the call. You must answer all questions and fill in blanks. Sometimes there will be a free text area that you will have to complete to say how you resolved an issue. When you are done answering the questions, you'll see screenshot number 10, and you will complete and sign. If you're not finished, you can save your draft. If you are finished, you would click complete and sign. Once you click complete and sign, you will see screenshot 11 at the top of page 7. If you are a TouchWorks user and you need to copy and paste the document into the EHR, this is how you would do it. Where it says Care Transition Call, you will notice it is a blue hyperlink. If you open that by clicking on it, it will open the entire form. You can then right-click on the content, hit Select All, right-click again, and copy, and then you will paste the note into your discharge note in the medical record. Question 1 of the form has allowed you to answer global comments. If the patient has concerns that have not been addressed in that area on the form, you can add free text in your EHR care management discharge note or start a task to whoever it may be appropriate for, such as the provider or clinician that is taking care of the patient. That's the training document. Please feel free to reach out to us if you have questions, and thank you for your time.